Moments with Dr. Greta are brought to you by the Ashley Clinic in Chanute, Kansas. Curiosity, that human endeavor that's so important for quality of life. It starts at 2 to 4 months of age when that little baby's looking at you and wondering what's going to happen next. And then it progresses until we get to be in junior high school age, and we are saying, well, how come something has to be the way it is? Or what's more sinister is sometimes we look at FOMO and doom scrolling, especially in relationship to smartphones. Yep, that smartphone thing. It's got wonderful capabilities, but in junior high and high school ages, it seems to trigger some of these other emotions, these feelings that are part of curiosity. For example, when we are in that age range, we're wondering what other people are thinking of us, we're wondering what's going on, and the cell phone allows us to do something called doom scrolling. Yeah, in other words, you're just mindlessly scrolling back and forth and you're trying to find something, and your brain automatically, because of the age in your development and curiosity, oftentimes then you'll pick out the negative things. And that actually changes the brain capacity for growth and development. And in fact, according to a study out of pediatrics, smartphone usage was up a lot in 12 to 13-year-olds, and those kids in particular had more obesity, sleeping problems, and depression. It's important for parents to understand the human development aspect of curiosity. After all, have you heard that old saying about the cat? Well, in junior high age, we think we have 9 lives. But then all of a sudden, there comes that 10th one because that curiosity does stuff like possibly cause addiction. One theory of addiction is that dopamine gets revved up. Well, curiosity will rev up our dopamine, but we want to be sure that we don't let it get out of hand. And that can happen with FOMO and doom scrolling. So keep it